An ulcer is a break in the intestinal lining or of the stomach lining. Ulcers are very common. In fact, there were 5 million ulcers reported in the United States last year. There are many different kinds of ulcers. There are ulcers of the stomach and ulcers of the small intestine. These are the most common types of ulcers. Ulcers can present differently. Some patients experience pain in the stomach, and this pain is typically relieved when a patient eats food or if they take a medicine such as an antacid. Ulcers may also present differently, such as with nausea, vomiting, and sometimes with acid reflux symptoms. It is important to remember that ulcers can sometimes be completely painless. This is especially common in elderly patients and in those who are taking medicines such as ibuprofen and naproxen. There is a common notion that stress causes ulcers. Now we know that this is not true. In fact, stressful behavior can predispose to ulcers. Things like smoking, drinking excess amounts of alcohol can lead to ulcers, but nothing compares with an infection called Helicobacter pylori. We now know that this causes almost 80% of ulcers. This infection can not only cause ulcers, it can also lead to cancer of the stomach. In the past, we used to use tests such as X-rays to diagnose ulcers. Now we have a test called an endoscope. This is a small tube that has a light and a camera at the end of it. The patient is sedated and the tube is passed into the stomach. Not only can we diagnose ulcers, but if an ulcer is bleeding, it can be treated at the same time. We can inject medicines, we can even cauterize an ulcer and hence stop the bleeding. This would save the patient from having major surgery. Typically, we used to use medicines such as antacids to treat ulcers. Recently, a new group of medicines have been discovered that treat almost all ulcers. In fact, we can completely cure ulcers with medicines alone. These medicines are called proton pump inhibitors. When we discover ulcers, we typically give a course for about 2 months, and most ulcers are completely healed. Lastly, if a bacterial infection is detected in the stomach, it could cause the ulcer to recur if it is not treated. This is easily done with a short course of antibiotic. So if you are experiencing pain in the stomach, or nausea, or excessive acid reflux, remember this may be caused by ulcers, and ulcers can be treated.